Hello, everybody. My name's Joel Filderman, and welcome to the Dog Trainers Connection. I'm not a dog trainer, but the people you see here are, and they have a number of years' experience in the dog training world. We get together to discuss a topic, come up with some interesting thoughts, sometimes come up with some answers as well. But the discussions are always interesting. And the topic I'd like to discuss today is there's a new trend, not necessarily new, but it's newer, about fear-free vet and going to a fear-free vet and what that means. And Steve, since you're a former vet tech, why don't you tell us a little bit about what that does mean?
You know, I don't think there's such thing as former vet tech. I think once you sign up, you're stuck for life.
Once you're in, huh?
Once you're in, you're in. You know?
Okay.
I mean, geez, the license never expires, till the heart stops beating. Anyway.
Okay.
The fear-free, there's a movement. It's the last time I spoke to a veterinarian about it, he told me there were about 5,000 hospitals at that time, probably a year or so ago, that were signed up, and he got himself involved in that. I asked him some questions about what that meant, and he said, well, we're not going to work on an animal that's afraid. And I said, really? He said, yeah, we've already changed the environment. We've taken out a lot of the fluorescent lights and put lamps in. We have nice soothing music. We have couches, that kind of stuff. We really try to examine the animal in a different sort of setting to keep the animal calm and stuff. And I'm like, great, that's great. And he said the reason for my call is that they told me that I have to, if I'm going to refer a dog trainer, that the dog trainer has to be a positive reinforcement dog trainer, period. Mm. And I said, oh. He said, well, that's why I'm calling you, because you got that clicker and stuff. And I'm like, yeah, I love that clicker, but, I don't know if I'm going to be the guy. And he said, well, the book says that I'm supposed to hire somebody that either went to the KPA or he started with the whole,
Karen Pryor Academy.
He didn't know that's what it meant.
Okay.
No, because when I said
took me a minute, but yeah.
Well, he should have known what he's talking. The KPA. I'm like, what do you think that means, Doc? And he's like, I don't really know. I have to look that up. And I said, it's the Karen Pryor Academy. And then you started talking to me about, the test credentials from the APDT and this kind of stuff. And I said, well, I don't think you could refer to me. And he said, why not? You're positive. And I'm like, I am, but I'm not going to swear on a stack of Bibles that every single thing I do is going to come from that side. I don't go that way. You may need to find somebody else. It turns out that his sister-in-law is a dog trainer, old school, like leash and collar compulsion trainer. Mm-hmm. She does the 16-week program with everybody, the old, right? Heel first, all that, the turns, boom, boom. But she's seriously effective at it, doing that and in the way she does it. Really got the touch, not an abusive person in any way. And I said, you've got a sister-in-law who's an amazing dog trainer. He goes, I can't use her. She's not positive. I'm like, I don't know if you could use me either. I'm not all positive. So, right away, that was interesting. In the meantime, kicking back, the Dr. Sophia Yin from UC Davis, she was the first one that really came around with, this could go a whole lot easier if we teach them things. We give them these experiences, experience the table, experience the touching the feet and the ears, and just really great advice, and definitely moving toward different treatment in animal hospital settings. She wrote some books, produced some videos, which at Mercy College they use as teaching tools. Mm. Everybody should have just jumped on then. A lot of people did. But then Dr. Yin passed away, and Dr. Marty Becker seemed to kind of jump into this thing. I don't really know him. He's sort of famous, but he's the one who developed the catchphrase, the fear-free animal hospital thing. I don't know, maybe I'm sensitive, I kind of feel like the hoopla belongs to Dr. Yin, really, but that's just politics. Mm-hmm. They're very specific, about how you can do and what you can do and all that kind of stuff. And I like the idea. I mean, at Mercy, before the whole thing, We were teaching technicians how to be more gentle, how to make the handling. But we also are being taught how to effectively handle the animal to get the work done. So we used muzzles. We used all kinds. We used whatever we had to do to be able to give a cat an injection into the femoral vein. You got to get them on its side and expand, take the bottom leg out, just to expose the vein. Usually that's about scruffing a cat, stretching them out. You think a cat likes that? Definitely not. They're not awake very long as you hit the vein. They're out in like 2 seconds. But, you know, for the time that you have to restrain the cat to get to that, there's going to be some moments there. Then they're not comfortable. Now, can you wrap the cat in a towel and try and get the vein exposed, wet it down and try and hit it? You can. And if the cat's mellow, you can get away with that with less stress on the cat. But what if it's not? What if it's sick? The vet I spoke to, I asked him, I said, Doc, what if the animal in your warm, comfortable setting is still afraid and is fighting the exam? He said, I send it home and I bring it back another day. I'm like, it's sick. Is sending a sick animal home because you just can't do this?
Because the environment and the temperament isn't right. And
in some ways, the fear-free thing is like putting handcuffs on some veterinarians and saying, you can't do this, you can't do that. And I'm afraid that the medical, if it's going to affect negatively their medical decisions, that's going to negatively affect our pets when they're getting examined. So there needs to be as much balance in understanding that an animal needs to be examined. And it may be afraid. I don't think it's unnatural for it to be afraid. Nobody's trying to hurt it. I mean, these people spend their whole life trying to help animals. How do you start to condemn them for the way they're handling them? You just can't do it. You just can't do it. They could have went to medical school and made more money. You know, these people love animals. They're trying to do the right thing. Nobody's out there trying to harm your animal in an animal hospital.
Right.
And you sort of have to take the cuffs off the doctor and allow him to do his job in order for him to best help your pet. That's just the way it is. I mean, can you do it gently? You should be thoughtful. We should always been thoughtful. I mean, you know, what can I say? But now they have a thing and they're really pumping it out there. This is the way. I'm like, well, you know, if all of a sudden they're not going to touch a sick animal because it's stressed, I don't know where we're going. You know, I'm a little nervous about that.
Okay.
So that's my take.
And Jeff, what about from the rescue side of it? What about you bring a dog in and you have to bring that dog to the vet? You know, can you really be dealing with it from a quote unquote fear-free side?
All right, so come on. I mean, what the hell is going on in this world? Do you think I go to the doctor and I'm like, geez, I'd really hope this colonoscopy is as pain-free and wonderful as possible? I mean, the shit that we're friggin' throwing at dogs, it friggin' baffles me. I'm sorry. It's a friggin' vet. If my dog's leg is broken, okay, I want a capable vet who knows what the hell he's doing, okay? My dogs are socialized. They are trained, okay? When I get my dogs, guess what? I train them at my vet's office before they're sick. I socialize them in a variety of environments. They're constantly overwhelmed with positive association in a shitload of environments, okay? And guess what? If they have a broken leg, they're already stressed, okay? Going to the vet, yeah, it's going to be stressful. So what? They'll get over it, okay? Unlike humans, our dogs are capable of getting over shit. I'm sorry, okay? Now, granted, there's a fine line between mishandling an animal, like Steve was alluding to earlier, right? I wouldn't, in fact, when I go to the vet, I could probably count on 2 hands how many times my animals, whether it was my personal pets or rescues of mine, actually, I can't count on both hands because most of the time I handle. And if they don't let me handle, I go find a new vet.
Okay.
Bottom line, right? Now, obviously with spaying and neutering and surgeries, obviously they have to leave my site.
Sure.
Right? It's not like I'm accompanying people, you know, the animals to the operating room. But for regular vet visits and stuff, nail clippings and whatnot, you know, poking and prodding and temperature and ears and mouth and all that stuff.
Why don't you let them leave your site, Jeff? Why?
Because they're my dogs. period. Why would I let my animals out of my sight for some 22-year-old person who has little to no experience handling animals, handle my dog or cat to clip their nails, right? If I'm the handler, first and foremost, that's the least stressful environment for my dogs.
That's what I was going to say.
Regardless of where I am, whether I'm at a bus stop or the vet's office, if I'm the one handling my animals, that is the least stressful, right? Because, and let's just say, with Steele, okay, come here, buddy, okay? Now, people think this is cruel, right? But we have a really good relationship, right, buddy? Come here. And I can turn him over and I can cuddle with him, right, baby? Can a stranger do that and it's not stressful for the cat? Probably not. Mm-hmm. And it's not like I walk around and hang my cat. Obviously, it was just for illustrative purposes because Steve had mentioned scruffing a cat. But the fact of the matter is my animals trust me. Furthermore, from a rescue standpoint, I have animals that I kind of know what's going to happen if someone handles them. Mm-hmm. And I don't want that animal to be set back from, what I would perceive as a provoked bite. But in a court of law, it would be an unprovoked bite, right? So if anyone's getting bit by a rescue animal that is under my care, it's going to be me, right? Yeah. So, and I obviously I get animated because I get animated about everything. And I understand the whole fear-free thing. But, come on. It's a doctor's office. It's a vet. You know what it is? Like, I really think humans think that our animals are stupid. Excuse my language, okay? They're not. They're not stupid. They get over things a hell of a lot quicker than we do. They're capable, okay? They're capable of overcoming an assortment of things better than we are. The fact that we humans are so incapable of dealing with life, guess what? Our animals don't. They get over it, right? When we talk about dog training, how many of us here have probably said in the course of these things, especially with dogs, right? When we're working with dogs, whether we're teaching a new behavior or modifying a behavior, dogs are here and now. They're moment to moment, right? We're working with behaviors as they arise. We're teaching behaviors as they occur, right? Guess what? By the time you get home from the vet's office, they're over it. Humans, not so much. They'll carry on and they'll be stressed out for another 2 weeks.
Yeah.
Yeah.
Yeah. Well, and also these are our pets. It's me, I'm a dog trainer, but pet owner, and we bring them to a vet, which is why, Jeff, you want to handle your pets. But I think, correct me if I'm wrong, Steve, historically, maybe it's lately, but historically vets would say, sorry, we have to take it legally. If something happens and somebody's injured, we're liable. We have to take your animal to the back. And most people said, okay.
Well, in New York State, there's signs in a lot of animal hospitals that says, please don't ask to handle your own pet.
Really?
Yeah, because if the owner gets bit, the vet's liable. And so in Jeff's case, him holding his animal, the guy with skills and the relationship, that's because he has a normal relationship with the pet. How many pet owners ain't straight at the vet's office? They're nerve bags. They're holding their own animal. They're nervous. You cannot trust them to hold their pet well. The vet's going to get bit because the owner's like, it's okay, Fluffy. It's okay. And the dog's going, And the dog hears it's okay to kill the vet. And by the way, when you try to bite him, I will jump in and jump on this vet and chew his ankle. That's how the dog feels when you're over there. It's okay. It's okay. No. If you take them away from the owner, I have seen ferocious dogs. Ferocious in the exam room. You take them in the treatment room and they shut down. They don't need to be handled hard. They just need to be separated from the lunatic in the exam room who's helping them. They're almost encouraging the anxiety that's going on in there. So who's handling depends on who we're talking about. It's not, I could go with the Jeff story because we're talking Jeff. He knows, we have skills. I'm telling you, the average client, you don't want to be in a room with the pet and them. It ain't good. It ain't good. I swear some of them faint. We've had to recover people off the floor for different things, so you pull a roundworm out the rear end, you got to scoop the client up off the floor. It's like, oh my God, what's that? And boom, down they go, sometimes it's good to remove the dog from the client. It really is. Not because you're hiding anything, because it actually helps reduce the level of stress. So, that's something for the vet looking at the dog and the situation to decide. And they should ask, may I take your pet in the treatment room to make sure you're comfortable with that? If you're not, they shouldn't do it. But if they say, look, the dog is, if they can explain it to you, it makes sense to you, maybe the dog would be better off. They usually, like even nail clips, Rotties, this is like famous for me. Big male Rotties, nail clips. You try and do it in front of the owner, it's like you're dead meat. You take the dog in the back, the dog's giving the foot. Here you go. Let's get this done with it so I can get out of here. And
wow.
they leave with their tails going like this. They're not, it's a moment. It's a moment. So
and a painful moment for an owner when you hear your dog shrieking and maybe,
it's afraid. It's afraid. It would be afraid with you there. It's afraid if you're not. It's just if you hear it shrieking and you don't see it, now you're having a stroke yourself because now you have thoughts about what might be going on back there. And if you don't trust your vet, you should find another one.
Okay, and guess what? Okay, so if your dog is uncomfortable, ill, sick, injured, and is at the vet's office, and again, I obviously I was speaking from my own point of view as a handler, so I'm glad Steve pointed that out. I get the whole thing with owners, but the subject that we're talking about is this whole fear-free thing, right? So regardless of whether the dog is with the owner or brought to another room, okay, that doesn't reduce their level of discomfort, okay? Music, essential oils, lamps, okay? That doesn't minimize or maximize stress levels, okay? If the dog is stressed, the dog is stressed, or the cat, whatever the case may be, right? I don't know, maybe because I'm just too narrow-sighted that if my animal needs medical care, give my animal medical care, okay?
Helen, I had heard you say something before we started about, when we talked about the topic about you training your dog.
Well, basically, when it comes to fear-free veterinary, I don't think there's any such thing personally. However, we're talking earlier about if the dog is sick or got a broken leg, things like that. But much of your medical or veterinary visits are routine. Shots and checkups and senior care. It's not always about sick or injured. So I feel as though a lot of vets, or in my experience, veterinary offices, I feel manhandle more than they need to in those situations, particularly when their client is me and my dogs, and I'm saying, don't worry, I've taught my dog this. Just let me work my dog while you do what you need to do. I don't like when they take them in the back room. If they're going to take the dog away from me, and I hear what you're saying, Steve, that sometimes you have to get them away from the owner. But if they want to take my dog away from me, I'm on to the next vet that I can find.
What if it needs an X-ray?
Well, that's different. All right. That's different. But they're not going to take my dog in the other room to do a
nail clipping
or nail clipping or anything like that. An X-ray, they have to be on the table. And actually, the vet I'm using now has offered for me to be there as well, but I didn't want to be in the X-ray room.
And did you, when you found a vet that's thoughtful to you, did you explain that you are a dog trainer, that you have experience? And because I know when I did that, and I said, and I have some close colleagues who are vet techs, and that helped with the vet relating to me as more of a professional, even though I was a freaked out, nervous pet owner as well. It helped the vet relate to me better when I said, Joel is really good with holding Bianca, and she's very relaxed and comfortable with him doing it during the exam. Would you please let him do that? And he was fine with it.
Right. Well, yes, the vet the vets, they all know I'm a trainer when I go in.
Okay.
But one of the things they always comment on is how well behaved my dogs are. Because part of what I've done is practice examinations. I've, practiced doing things that a vet would do while I've taught them to target and hold while an examination is going on. So with a stethoscope, listening to their heartbeat, taking their temperature, feeling their limbs, feeling everything. Now, this is all for routine examinations. If my dog is sick or injured, it's going to be a little different maybe. But so they do let me have my dogs do a target hold. In fact, they actually encourage it because my dogs do respond better when I am there. They absolutely do. As soon as I'm separated, they get a little more stressed and antsy. Yes, they're stressed at the vet anyway, but it's much better when I can stay with them. And so, as you were saying, Steve, it depends on who it is. But I just don't think they always have to come in with the bear hug that they do to hold a dog. They just dive right in with that, scruffing a cat. Sometimes a cat does have to be scruffed. I get it. But, when I used to scruff my cat, it was in a very gentle way. I don't just grab. I'd be like, okay, come on. So I don't know. I hear what everyone's saying, that it's ridiculous and the vet just has to do their job. But I've seen some vets that I'm never going back. I don't like the way they handle it. And their assistants are, they are very often young kids that don't have a lot of experience. They're just, I don't know. I'm a little bit on the fence. Fear free, I think it was ridiculous, but kinder, gentler is not, I don't think, too much to ask. And somebody mentioned, I'm not sure, about that, oh gosh, the kinder, gentler.
Sophia Yin.
I just brain farted. Dilate my eyes and the brain goes out the window.
Oh, that's why the glasses.
Yeah.
I mean, obviously I get animated about a couple of, about stuff. I mean, that's just who I am. I mean,
Sure.
If I'm sad, I'm sad. If I'm happy, I'm happy. If I'm animated, I am who I am. I don't apologize for that. I also acknowledge the concept here, right, of the whole fear-free veterinary visit. Okay, it's not that I don't acknowledge it.
Do you think that it's been taken to the extreme?
Everything's taken to the extreme. I mean, pick a friggin' industry, pick a topic. Everything's taken to the extreme, right? Sometimes things just are what they are, okay? And, Helen made a good point, right? Most visits, or maybe Bonnie, most visits are routine care stuff, right? Getting poked with a needle is not fun. Doesn't matter what kind of aromatherapy you got going on. It's not fun, right? And, there's good vets and there's crappy vets, all right? Yeah. So you're going to have good fear-free vets and you're going to have crappy fear-free vets.
And
right?
And the same with vet techs.
Right. It goes back to owner responsibility. The owner of an animal ultimately is accountable for putting their pets in the best position to get the best care, right? We have to be champions for our animals, right? We just happen to be professionals. So that's why I had a little bit of a narrow-sighted view because, I am the primary handler when I go to the vet. But regardless of someone's handling ability and regardless of whether a vet is fear-free or not, you have to choose wisely and you have to be champions for your animals. Like Helen said, if they have to be physically handled, sure. I mean, we all want our animals to be handled as gently as possible, right? I've had dogs in the vet's office that we actually, we had to handle in a manner that I don't handle most dogs. Because of the risk of the dog biting someone. And I'm not talking about a Chihuahua that's nipping people, okay? I had to pull out all the stops, right?
Mm.
But again, that's me as a professional. If it's an owner, that's one thing. Bottom line is that owners have to be accountable. They have to be champions for the animals and choose their vets wisely.
And that seems like a good place to stop this conversation. I think that is a good way to leave this. I think that's really what this conversation came down to.
I apologize. I cursed. Usually I throw an S out there, but it kind of got away from me. But
wouldn't have been you if
it's like same thing when I'm driving. I say the same thing. If I cut someone off, I say sorry. I'm from Jersey.
Oh, Jeff, you say S instead of shit, but you just totally dropped the F bomb.
I know. Usually I say frickin', but that one
today.
It just flew out.
Anyway, now that we've infuriated the state of New Jersey, I'd like to thank everybody for being here today. And I'd like to thank you all for watching. And we'll see you next time. Thanks a lot now. Bye-bye.
Bye.